you looking for the perfect birthing plan for you, your family, or a friend? Today I want to talk about some different options, and in particular the epidural. An epidural is an option that I would like to use for my second child, and that's what got me interested in today's speech. An epidural is a needle that is placed into your lower back, and this will cause less pain for you, and pain at the time you don't have to worry about either because you are numbed. The anesthesiologist comes right into your room. As you're sitting on the bed, he has you bend over and he inserts the needle here. He can also show you on Rita, if you could please step up. On someone's back, it's right about in here. And then he'll go ahead and allow you to sit back in your seat in regular, and then before you know it, you have a baby. What the epidural does is it numbs part of your body, and you can kind of control that. A lot of epidurals, there's a button you can use that will go ahead and you can keep giving yourself more medicine, and a doctor can take that away if you're overdoing it as well. Another benefit to an epidural is that you can go straight into a C-section from an epidural, because then you can already have your lower parts numb, so it's a little less to worry about there. Also, Melody Meyer wrote for Slate.com that does not increase the chances of a C-section. She did a little bit of research with 15,000 women, and they went ahead and found out that that is untrue. It does not increase at all. That article was the truth about epidurals. Also, back to that, you can have a C-section or a vaginal birth using an epidural. The research was done by Samantha Phillips in 2010, an article called Fact versus Fiction for Everyday Health. And another thing that's great about an epidural is it can protect a woman's pelvic muscles. This is beneficial to the father and the family members because it's less pain for the woman as well, and not only during labor but also after, because you have less chances of tearing, which can help you recover towards the end while you're trying to take care of your baby. This was research done by Jennifer Bunn from Healthy Living in 2010. It is crucial to keep in mind that there are some risks to an epidural, so you do want to find a doctor or OBGYN that has all the facts. There's so many wives' tales about epidurals, and it's important to think nowadays 60% of women actually go with an epidural plan versus other drugs or just doing it all natural. Another thing to keep in mind is an epidural can help because you're still aware of what's going on versus some of the other drugs who make you sleepy, give you headaches, and give you symptoms that you're not going to want when you're trying to focus on birthing your baby. I will be having my second child hopefully coming up soon, so I've been doing a lot of facts and looking into the facts and questions and trying to figure out if epidural is correct for me for my second round. The first time I went to do an epidural, unfortunately I just didn't have enough time to get it all in. I did receive an epidural, it just didn't go into effect, and I was able to walk away. It is crucial to also think that sometimes when using an epidural you cannot walk afterwards, so you have to wait a little while before doing so. Also, I wanted to say that we did a survey, Healthwise staff in 2012, also for Everyday Health did a survey, and it was called The Truths. It just kind of told us about some more of the side effects that can happen from an epidural. It can cause longer labor, so it's something to keep in mind. And you are unable to feel your contractions in most scenarios with an epidural, so it's important to remember that you may need some assistance with tools such as forceps and things like that. The last major concern would be that it can drop the baby's blood pressure if the woman does not have enough fluid in her system. So it's important that the doctor brings in an IV bag and gives her that fluid before the anesthesiologist comes in to give her the full epidural. And I was just wondering if anyone had any questions for me.
I do.
Sharon?
How long is an epidural needle in your back?
An epidural needle really is only in your back for 1 to 2 minutes, so it's not as scary as some would say. It is a large needle, but they do a really good job at not letting the mother see, and hopefully your fiance, husband, or loved one does not make a funny face, because that never makes for a good time. Does anybody else have any other questions?
Do they do anything to prevent the baby's heartbeat during an epidural?
Yes, that's what I was talking about with adding that fluid. That will really lower the risk of that happening. So when the doctor comes in, you want to get a full bag of IV fluid put into your arm before you go ahead and have that epidural, because that would stop that from happening. So what's important to remember about this speech is really that you want to make sure you find an OBGYN or a doctor that can go ahead and kind of give you some different options and let you know about the pros and cons of an epidural. You don't want a doctor who's just going to say, no, don't get an epidural because of this or that. I mean, there's so many wives' tales out there, like I had mentioned, about the epidural and how it's not good for many women. My concern is that everyone does their research as well and knows that it is okay.